our speakers. I'm going to kick things off today and introduce our speakers in just a couple of minutes. I just wanted to preface with a couple of remarks. The opioid situation and the opioid epidemic and just the challenges of addiction are a huge and important challenge for us in public health, and one that predates the pandemic that we've been struggling with recently. And one of the things that I think we've all struggled with is it's hard to get at the root causes and figure out how to prevent addiction and some of the awful outcomes of addiction. But the one thing we're lucky about is we do have a lot we can do to help people who are suffering from addiction and using opioids. And that's a little bit of our theme today as we bring on our panelists and talk about some of the developments that we have that we can really celebrate and push forward with the public. I'm going to go ahead and introduce the two speakers that we have queued up from our states today. I'll start by saying we had intended for Dr. Dan Edney from Mississippi to join us, and he's had something come up in the public health department there and is not going to be able to join. So we have two speakers. I think we're still waiting for Dr. Adams to come on, but he is on the way. And let me just go ahead and introduce him. Dr. Adams is the 20th U.S. Surgeon General. And we all remember him from that recent role. And he's now the executive director at Health Equity Initiatives for Purdue University. And then the second speaker that we'll have is Dr. Stephen Stack, who is our ASTHO president this year, and he is the commissioner of the Kentucky Department of Public Health. So has Dr. Adams joined yet? He is. Okay, good. Jerome, glad to have you. And I'm going to turn things over to you to start with your remarks.
Well, I'm actually in transit, so I would defer to Dr. Stack to start. I'm going to be in front of my computer in about 10 minutes, but I'm really happy to be here today. I think this is incredibly important. As you all know, I put out an advisory calling on more people to carry naloxone back in 2017, and I think that the need has only become that much greater in the intervening time. But I'll be on screen, and like I said, hopefully 5 to 10 minutes. So if Dr. Stack is there, I'd let him start.
Yeah, sure. So I'll make a couple of more comments just to kind of lay out the current situation for people. Then I'm going to turn it over to Dr. Stack and let him speak a little bit, and then we'll circle back. And hopefully by then, Dr. Adams will be at a place where it's a little easier for him to speak and make some of his points. We're very concerned about overdose deaths. This was a huge problem before the pandemic. During the pandemic, we were obviously stretched, and this was something that was a lot harder to really keep top of mind. But it has. I wouldn't say it's reemerged. It's always been there, but we are really trying to shift public health attention back to this important issue because it's getting worse. I mean, at the end of 2022, there were over 109,000 reported deaths from preventable overdoses. And that's the tip of the iceberg deaths. I mean, you've got a whole lot of people suffering sort of in those numbers under that. But, those are deaths that could be averted. And that's up from the previous year where it was just 106,000 people who died. So, we're continuing to see an increase here, particularly on one of the public health measures that we're most concerned about. In 2021, of the 2021 overdoses, 80,000 of those overdoses, so almost 2/3, involved in opioid, or including natural and semi-synthetic opioids, which are arising now as one of the biggest challenges. Those are things like methadone, heroin, and other synthetic opioids. And the one that has really gotten into the public's attention is the extremely potent fentanyl. What we want to talk about today, and I'm going to turn it over to Dr. Stack now, is one of the interventions we have at hand, and that is naloxone. And I think that Dr. Stack will probably talk to you a little bit about this, but I'll say too, I mean, him more than me, have spent time working in emergency departments, and when you have done that, you've administered naloxone to people, and it is extraordinary how it's almost miraculous how effective it is at reversing some of the consequences of somebody overdosing on any kind of opioid or other substance. So, it's an important tool for us. It's a tool that's very, very safe. And that's one of the areas we want to focus on in some of the comments of what the federal government is doing, but also what states are doing to make this potentially life-saving treatment more available. So, Dr. Stack, let me turn it over to you now, if that's okay.
Sure. Thanks, Dr. Plescia. And good afternoon, everyone, and thanks for taking time on this important topic. Let me just give a little information about naloxone itself, just to get us started. So first of all, overdoses can be prevented, and saving someone from an overdose gives them the opportunity to seek treatment in the future. Naloxone is often administered by first responders or bystanders, and bystanders are present in more than 1/3 of overdose deaths. So if someone has naloxone and someone knows how to use it, at least 1/3 of the time, there's the possibility of someone able to immediately respond and save a life. Some models predict that equipping more people who are likely to witness an overdose with naloxone would reduce overdose deaths by as much as 21%. That's 1 in 5 people currently dying from this horrible disease. That's over 20,000 people a year in the United States. So the opportunity for positive impact here is enormous. Though naloxone is given to the person experiencing an overdose, it's most useful in the hands of the bystanders and the first responders, not the person themselves. Because one of the things that opioids do is suppress your consciousness and awareness along with your respirations, which is what causes the death. And so they are not often able to give themselves the medication. It requires someone else who is present. Naloxone is an FDA-approved medication. It quickly reverses and overdose and blocks the effects of opioids, which include fentanyl, heroin, and other prescription narcotics. It restores typical breathing within 2 to 3 minutes. There are no known major adverse side effects to administering naloxone to someone experiencing an overdose. And it's available in various nasal sprays. And I'm just going to show you here. You can get a 2-pack in a box that looks like this, Narcan or naloxone nasal spray. When you open that up, you find a little inhaler that looks like this. It's incredibly simple to use. You peel back the backing on this, and you put the, just like you would with a nasal spray when you have a cold, you insert it into their nostril and you squeeze the little red button at the bottom. That's all you have to do. There's no like mouth-to-mouth resuscitation and CPR or basic life support. This is simply squirting the medication into someone's nostril. And this can have an incredibly life-saving effect by undoing. Yeah.
All right, you got the tree.
I apologize.
Hi,
Hey, you got the tree.
I got the tree. It's very cute. Here, I'll show you.
Oh,
Hi, if
So,
we could make
There we go. Did you find it? I was like, what tree did we get? Anyway, so here's the Narcan, but I'm happy you got a tree, and I hope it's wonderful, and I hope it's better than Charlie Brown's Christmas tree. So here's what the naloxone looks like when you get the little squirt bottle. And there are even organizations, one in particular here, the Naloxone Project, and you can find them at the naloxoneproject.com, that actually distribute these widely with one of those carabiners that you can attach it to things, and information about how to actually use and administer the medication. And so there are a lot of efforts to make this available. Here in Kentucky, we have even positioned things that look like what you might be used to seeing, newspaper dispensing boxes in communities full of Narcan so that people can come and take it when they need to. We have learned additionally that it is very important to make it readily available and easy for people to immediately have the medication, because when we prescribe it to folks or to their loved ones, the fill rate for the medication is very low. So it's important to be able to have the medication available and to dispense it to people and hand it to them so they can use it. It's also important for first responders who act to save others that in most states, administering naloxone in the event of a suspected overdose is protected under Good Samaritan laws, and that they are linked to lower rates of overdose in jurisdictions with these protections. Many states also have laws that can protect individuals who call for help because of an overdose, protect them from other legal trouble. It has recently been approved, naloxone, for over-the-counter sale. So now people don't even require a prescription. And people can get this at pharmacies, at community-based overdose education locations, and community-based boxes, like I said here, it's syringe service programs. In Kentucky, we unfortunately are one of the ground zero states for the magnitude of impact of opioid overdose. We have more than 83 syringe service programs in 65 counties, which is more than half of our counties, who actively work with the community that is suffering from opioid addiction and overdose risk to help them get assistance and to help prevent adverse harms and death. Now, folks, I'm going to leave you with just a couple other points that are not specific to naloxone. This is a disease. This is a disease similar to someone who has other medical problems. Once you use these medications and you develop substance use disorder, there are chemical alterations in the brain of the user that impair their decision-making capacity. They require assistance. They require help, just like someone who is experiencing alcoholism, someone who is experiencing tobacco addiction or nicotine addiction, or people who have other chronic medical problems like diabetes or heart disease or kidney disease. Once you acquire this disease, they require a medical approach and medical treatment. It's very important that we work to destigmatize this disease and recognize these people as suffering from a treatable condition, then that we work hard to try to make the resources available to help them. And in today's press briefing, naloxone is clearly one of those. And around the holiday times now, I really hope that we could enlist the support of all Americans to try to help rally together to try to turn the tide on this terrible affliction and epidemic in our society. So, Marcus, back over to you.
Yeah, and I think I see that Dr. Adams is on, and Dr. Adams, you've provided such great national leadership for this. So can we turn it over to you? Are you ready, Jerome?
I'm ready. I'm here. Can you see me and hear me?
Yes, we can see and hear you fine.
All right. Well, again, thank you for joining. And Steve and I go way back, 20 plus years, been working together. And I just really appreciate you giving that wonderful overview from an emergency medicine doctor's perspective. I'm an anesthesiologist. So similar to Steve, I've given fentanyl regularly. I've given naloxone regularly, both within the last week. I can tell you that both are incredibly powerful. And that's one of the big take homes that I want people to leave with today. The opioid epidemic continues to evolve. It started in many ways as a prescription overprescribing, a prescription drug crisis, and we squeezed one part of the balloon to clamp down on prescribing, and we saw people shift to heroin. And as many of you all know, I was the health commissioner when we had the largest HIV outbreak related to injection drug use in the history of the United States in Scott County, Indiana. We saw sequelae of that injection drug use, hepatitis C rates that have been skyrocketing, and also overdose rates starting to go up. But the newest evolution has been fentanyl. And it's interesting. I was asked the other day about fentanyl test strips as harm reduction. What we're talking about here is the broader umbrella of harm reduction. How do we engage people who are misusing substances and help mitigate the harm while we try to connect them to care? And that includes supervised injection sites in some places. That includes fentanyl test strips. That includes naloxone and opioid overdose reversal agents, and a number of other different remedies. But what was interesting, and the point I was going to make about the fentanyl test strips, is that I think that they were incredibly useful a few years ago, and I think they continue to be useful in certain situations. But when you look at the fact that 90+% of illicit drug samples now from persons who inject drugs are coming back positive for fentanyl, I actually think we need to assume that every sample has fentanyl in it. And since we have people who may not be aware, fentanyl is 50 to 100 times more powerful than morphine and heroin. And so I was speaking with someone who's been in recovery for 8 years a few weeks ago. And that person said something very striking to me. He said, it used to be incredibly hard to die of a drug overdose. And this was a person whose drug of choice was heroin back when he was using. He said, you know, if you're someone who's a regular user, you've got a regular supplier, you know what you're doing. He said, he said, I almost knew no one who died of a drug overdose back when he was using 8 years ago. He said now he knows lots of people who've overdosed and who die because with fentanyl, all it takes is one little mistake, a new supplier. It can happen in an instant. And we need people to understand that now more than ever, we can't afford to wait for an ambulance or first responder to show up to respond to someone who is not breathing. It can happen in an instant. And as Steve mentioned, Dr. Stack mentioned, over a third, and by some estimates, over half of overdoses are witnessed, and people are in a position to save a life. That's why in 2017, I put out my Surgeon General's advisory calling on more people to know about and to carry naloxone. And again, set a new record last year, 111,000 overdose deaths. It's even more important today as almost 100% of the illicit drug samples are coming back positive for containing fentanyl, that we have people in a position to respond immediately to that overdose. So that's the backdrop. I was speaking with ONDCP Director, Dr. Rahul Gupta, a few weeks back, and he shared another shocking statistic. And that statistic is that the epidemic continues to evolve, and now many young people are initiating drug use with pills and illicitly obtained counterfeit pills. So not prescription pills, but pills obtained on the dark web and through the internet. And the stat that was shared with me is that 60+% of these pills, according to ONDCP, are coming back positive for fentanyl. So you've got students on college campuses who think they're taking illicit MDMA, or thinking they're taking Ritalin, or thinking they're taking benzodiazepines, things which are still not appropriate, but which aren't necessarily going to kill you from taking a single pill. But with fentanyl in 60% of these, you've got kids on college campuses who are overdosing, and we need to make sure people are aware of this evolution of more fentanyl in more places, harder to detect, and that they're ready to respond with opioid overdose reversal. So Dr. Stack mentioned Narcan dispensers. I've been really working hard to promote those in places where you're likely to encounter an overdose, including on college campuses. We need to make sure we're making it more available on college campuses, concert venues, places where young people are going to be exchanging pills and possibly overdosing. And that's the call to action here, is to continue to raise awareness about naloxone, continue to make it more immediately available, easier for people to be able to respond if they witness an overdose. I believe that everywhere there's an AED, an automated external defibrillator, there should also be a naloxone, because the truth is, in many of our communities, you're far more likely to encounter someone who is having an opioid overdose than you are to encounter someone who's having a heart attack. And historically, I want people to remember, once upon a time, there were folks who were dying from witnessed cardiac arrests. And so we said, if there's something we can do to arm the public to be able to respond to this cardiac arrest while we wait for the cavalry to arrive, the ambulance to arrive. And that solution was CPR. And now you can't go in a room of 10 people and not find someone who doesn't know CPR. So we were successful in that vein. We need to do the same thing for opioid overdose reversal. We need to make sure that if someone is having an overdose, just as if someone's having a heart attack, that they are likely to have someone around who can respond. And that's by making opioid overdose reversal agents more widely available. The final point I would mention, and I will give you a disclosure here, I am an advisor for a company that has a new product called Opvi, or nasal nalmefene. That's my disclosure. Nasal nalmefene is FDA approved as of earlier this year. It is an opioid overdose reversal agent that is designed to pharmacokinetically and pharmacodynamically be more aligned with fentanyl. It has a longer duration of action, and anecdotally, and in studies that are out there, even though we have to be careful comparing different products based on FDA labeling. Anecdotally, it has a potency that more resembles fentanyl. And I mention this because when you talk to first responders, one of the challenges you're hearing now is that one dose of Narcan is often not sufficient to reverse a fentanyl overdose. In many cases, you're needing 2, 3, I've heard 4 and 5 doses of Narcan needed. And so we need to make sure we've got more tools in the toolkit to respond to an evolving war. And so originally the only tool was Narcan. So we all talk about Narcan, and that is still the mainstay. It's still our workhorse, but 13 states have now changed their standing orders from naloxone alone to opioid overdose reversal, so that we can make nasal nalmefene or OPV more widely available in addition to naloxone, knowing that may put particularly first responders in a better position to be able to respond to a fentanyl overdose. So I've gone on for a while. The bottom line is this epidemic continues to evolve. It's evolving so that fentanyl is in more places and it's harder to detect. And so we need to make sure if someone is having an overdose that is due to fentanyl, that people are able to respond quickly. And the way they respond quickly is by us raising awareness and availability of opioid overdose reversal agents, including naloxone or Narcan and OPV or nalmefene, both administered as Dr. Stack demonstrated by a nasal inhaler route, incredibly easy. This is my pack that I carry around with me everywhere that I go in my briefcase. I've got one in my car, again, because you never know when you might be in a position to save a life. And with that, I will turn it back over to Marcus, and I'm happy to take any questions that folks have.
Great. Thank you very much, Dr. Adams. Can you hear me? Yeah, okay. So hopefully what you've gotten a sense for here is the important role that public health agencies, state public health agencies, and local public health agencies have played in really trying to address addiction and the opioid crisis. And I want to reiterate that the approach to addiction and the opioid crisis is really kind of a multi-component, multi-dimensional. We have many tools that we're trying to bring to play to this, but one of the really important ones that I think you've clearly heard about today is naloxone or Narcan, which can make such a huge difference when somebody experiences an overdose. One of the things that states have done that is very, very important in making naloxone more available is making sure that they have Good Samaritan laws in place so that people can administer this medication, with immunity, without having it. There's not a lot of risk to giving somebody Narcan, but nonetheless, we don't want people to have any kind of concerns or insecurity when they do something that's intended to be in somebody else's best interest. And that's where the Good Samaritan laws come in. And just about every single state now has Good Samaritan laws. Most states also have laws so that if you are getting in trouble with an addictive substance and you need help, you can call and seek help with immunity so that you're not going to risk facing legal action for making that reach out. Those are two very, very important legal actions that states and territories can take, and most have taken them. We do have an ASTHO Public Health Legal Mapping Center, and we will post the link to that in the chat. So if members of the media want to go on and look and see who has what kind of laws around this, you can peruse through that as you go forward. So those were just a couple of other points I wanted to make to kind of close things out. And let's go ahead and open things up for any questions that you may have. I'm looking to you, Stephanie, but I think we're having people pose questions in the chat or raise your hands. Can you just pop in?
Yep. If anyone has a question, just feel free to jump in or look at the chat.
Well, people are doing this around the holidays. If your news coverage, you could also include the 988 suicide hotline, prevention hotline, so that holiday times are tough for people with substance use disorder. They're also difficult for people who have had loss and other difficulties around the time. They bring back difficult memories. So 988 is the National Suicide Prevention Hotline. And also for states that have resources like them in Kentucky, we have findhelpnowky.org, findhelpnowky.org, and findrecoveryhousingnowky.org. Those types of resources, which are building and expanding in different parts of the country, for the findhelpnowky.org, make it possible for people who themselves are afflicted by substance use disorder or have family or loved ones who are, to be able to go to a website and find what addiction treatment options are available in their community by mapping to their zip code and what types of services they're looking for. We also know that recovery housing is an important part of the recovery process, and that recovery-ready communities provide a supportive environment where people can go through the withdrawal process and then have others who have lived life experience suffering from the same condition and can act as a support group for each other as they navigate what is a fairly predictable journey through reapplying structure in their lives, learning how to live with this as a part of their lives, but not having it destroy their lives. And I had the opportunity to visit one of those recovery-ready communities in Appalachia just a month or so ago, and seeing the individuals there together in a community supporting each other really is powerful and impactful to see just how difficult this disease is for the people afflicted by it, how difficult it is for the people who love and support them, but also how, when we create the right conditions for people to have an opportunity, it is surmountable and they can overcome it and they can get to a better place if we are sensitive about destigmatizing it and making resources available to them. So I guess I would say, are there any other questions here for folks from any of the members of the media?
Yeah, just to reiterate, if you have questions, please raise your hand or post them in the chat. And, we've been talking about naloxone, but you've got experts in the field here. So if you have other questions about opioids or addiction, we can probably help with those too.
Well, and I just want to foot stomp something for the media that Dr. Stack just brought up. We talk about naloxone, and as I mentioned, there are folks who are frustrated because they feel like they're having to repeatedly administer naloxone to the same individuals. And what I would say is that, number one, again, addiction is a disease. I have asthma. There are multiple times I've had to use my inhaler over and over and over again. There are any number of diseases where we know they follow predictable patterns of bad moments and then good moments where folks are more compliant with treatment for any number of reasons. And then there's recidivism. That is the normal course of many diseases. And so we need to be careful that we don't stigmatize the disease of addiction in a way that is different than the way we look at other diseases, number one. Number two, opioid overdose reversal is a tourniquet. And Dr. Stack and I both work in emergency situations. You put on the tourniquet to stop the bleeding, but then you still need to follow up and treat the root cause of the issue. And we need to make sure we're using the opioid overdose reversal moment as a touch point to have a warm handoff to care. Care being a peer recovery coach, someone who's been through this and can help walk them through the journey to treatment. Treatment that is evidence-based, that is incredibly important. We know people have a much higher chance of being successful in recovery if they're adhering to evidence-based treatment. And then, as Dr. Stack mentioned, recovery-friendly communities are incredibly important. I also remember speaking to someone who was in recovery when I was in Philadelphia, and he actually said something else that stuck with me. He said treatment was easy. He said recovery was hard. And I had to think on that a moment. But what he explained is that when you're in treatment, in a evidence-based good treatment program, you've got lots of support around you. But when you leave treatment, you go back out into the community where many of the same triggers and many of the same temptations existed, and also where you then have the scarlet letter of someone who's been in treatment that prevents you often from getting a job, that prevents you from getting housing, it prevents you from being able to reintegrate successfully back into society. And so it's incredibly important that we create recovery-friendly and recovery-ready communities as part of the spectrum of put on the tourniquet, save the life in the moment, get them into treatment, but then give them hope for long-term recovery by actually creating recovery-friendly communities that include housing, that include jobs, that include an ability to feel good about yourself moving forward. And this is something that's very personal to me. And many of you know I've shared the story of my brother, Philip, who suffered with substance use disorder for most of his adult life. And unfortunately, he's still in the community where we grew up that is not recovery friendly, where he literally just got out of inpatient treatment 2 weeks ago and couldn't find housing. I paid for a hotel room for him for a week at the cost of $1,000 to my family. Couldn't find a job, and ultimately is now back in inpatient recovery because he was not able to be successful, or inpatient treatment because he was not able to be successful in a community that didn't have support systems set up for him. This is something that I personally am going through right now, as many families across America are going through this. So opioid overdose reversal agents like Naloxone or Narcan and Opvi are the first step, but we need to make sure we're leveraging that touch point and that opportunity to then put people on the pathway to successful long-term treatment and recovery.
Great. Well, thank you very much, Dr. Adams and Dr. Stack, for your comments here. And thank you again, all of you from the media who've joined the call. You know, I mentioned at the beginning, we really want to start to push this issue front and center again. And you all in the media do that so well. And we really appreciate the opportunities to interact with you on that. We will be available if there's additional questions throughout the day, and I think you know how to reach our team, who can reach back out to Dr. Stack or Dr. Adams or myself. But we'll go ahead and close things out now, and we'll look forward to seeing you all next time. Take care.
Okay, just us now. So, thank you.
Yeah, thanks a lot, Jerome. Good to see you. How are you doing? I was just talking to somebody about you. I'm trying to remember who it was.
Well, hopefully it wasn't all bad.
No, it was great. No, they were very, it was very positive.
No, but apologize for being on a little late. I was running my daughter to school. She got up late this morning, and so I had to rush back. And I know that we're back on at 11, and hopefully that was helpful and reiterated the points that you all wanted. I didn't mean to surprise you by talking about OPV, but it is something that I think when we talk about policies, and I mentioned this to you all being at ASTHO, we've got Good Samaritan, we've got standing order, we've got OTC, but one of the things that we